DHA Practice Test 2026 Dubai Health Authority Exam. Question 1. What does DHA stand for in Dubai Healthcare? Dubai Health Authority, Department of Health Admin, Dental Health Association, Digital Health Alliance. The Dubai Health Authority regulates the health sector in Dubai. Question 2. A mandatory requirement for a DHA license application is tourist visa, primary source verification, data flow, driving license, bank statement. Data flow verification of credentials is essential for licensing. Question 3. How long is a DHA professional license typically valid? 1 year, 2 years, 3 years, 5 years. DHA professional licenses usually require annual renewal. Question 4. Which lab result is most concerning in a client with severe gastritis and vomiting blood? Hematocrit 48%, hemoglobin 9.6 g/dl, WBC 8000, platelets 250,000. A low hemoglobin, 9.6, indicates significant blood loss. Question 5. A 4-year-old child's concept of death is usually final and inevitable, reversible and temporary, a long sleep, only for old people. Preschoolers often view death as temporary or like sleep. Question 6. A client on digoxin and furosemide reports hating oranges/bananas. Why is this a concern? High sodium risk, hypokalemia risk, vitamin C deficiency, hypercalcemia. Furosemide is potassium wasting. Avoiding K-rich foods increases hypokalemia risk. Question 7. The Sheryan system in Dubai is used for booking flights, professional licensing, buying medicine, ordering food. Sheryan is the DHA's online licensing and regulation portal. Question 8. What term describes hearing a roaring fire when it's actually just a shower? Hallucination, delusion, illusion, derealization. An illusion is a misinterpretation of a real external stimulus. Question 9. First action for a manic client running down the hall frightening others. Administer sedative, put in seclusion, accompany to a quiet area, call the family. Safety and de-escalation in a less restrictive environment is the priority. Question 10. Which statement about an AV fistula indicates a need for further teaching? I can check for a thrill. I can take BP on this arm. Avoid pressure on this arm. Call if it becomes red. Blood pressure should never be taken on the arm with an AV fistula. Question 11. Minimum clinical experience required for most DHA medical licenses. 1 year, 2 years, 5 years, no experience. Generally, 2 years of post-graduation experience is required. Question 12. Therapeutic response to an angry wife of a dementia patient. Please don't speak like that. You sound overwhelmed. We are professionals. He will be fine. Acknowledging feelings, empathy, is the most therapeutic approach. Question 13. Early clinical finding in Guillain-Barré syndrome. Severe muscle pain, weakness of proximal muscles, loss of deep tendon reflexes, numbness in hands. Loss of reflexes is a hallmark early sign of GBS. Question 14. Standard treatment for increased ICP, intracranial pressure, includes hypotonic fluids, mannitol, aspirin, ibuprofen. Mannitol is an osmotic diuretic used to reduce cerebral edema and ICP. Question 15. GCS score decrease from 14 to 10 indicates improvement, stable condition, worsening neurologic status, need for sleep. A decrease in Glasgow Coma Scale score signifies neurologic deterioration. Question 16. Ideal for solution for a patient with increased ICP. 0.45% normal saline, 0.9% normal saline, isotonic, 5% dextrose in water, sterile water. Isotonic or hypertonic solutions are preferred. Hypotonic fluids worsen edema. Question 17. Initial assessment for a cardiac cath patient via femoral artery. Check insertion site for bleeding. Early ambulation. Monitor lymphedema. Teach heavy lifting. Hemorrhage at the puncture site is the most critical immediate concern. Question 18. Best nursing action for an infant who is cold after circumcision. Place under radiant warmer. Wrap snugly in blanket. Encourage sleep. Give sugar water. A radiant warmer provides the most effective thermal regulation. Question 19. Nursing intervention for a patient with dyspepsia. Encourage spicy food. Monitor for occult blood. Give aspirin. Check for hearing loss. Dyspepsia can be a sign of GI issues requiring stool testing. Question 20. DHA exam registration is handled via which portal? Sheryan, LinkedIn, Facebook, Dubai.ae. Sheryan is the official portal for DHA health professionals.